as a child with COVID. So he may be tied up.
Oh, he's just got on.
Oh, perfect. Well, then I'll hold. All right. Good afternoon. It's Monday, January 10th, 2022, 4:32 p.m. I'd like to call this monthly meeting to order. May I have a roll call, please?
Andy Kornstrom,
Here.
Kyle Patterson,
Here.
Danielle Chenoweth.
Present.
We have a quorum. I'd entertain a motion to approve the agenda.
So moved.
Second.
Any discussion, changes? Hearing none, may I have a roll call, please?
Andy Kornstrom,
Yes.
Kyle Patterson,
Yes.
Danielle Chenoweth.
Yes.
That passes 3-0. Approval of minutes from the December 13th, 2021 Board of Health meeting.
So moved.
Second.
Any discussion? Hearing none, roll call, please.
Andy Kornstrom,
Yes.
Kyle Patterson,
Yes.
Danielle Chenoweth.
Yes.
That passes 3-0. Is there anybody here that would wish to address this board from the public? I see nobody on the Zoom call, so we're going to go ahead and zoom past that. No pun intended. Any correspondence? Sorry, Kyle. I mean, it's just, why not, right? Any correspondence?
Just
Yeah.
what do I say? You know, we're up
You
to,
haven't had anybody posting on social media or anything?
no, I just delete them off of there, but no, it's just been we're exactly where we feared we would be. You know, the hospital's being overwhelmed. We have right now, you know, probably 8,000 some people to be monitoring, which is not happening because you cannot do that. And it's happening everywhere, and hospitalizations and deaths keep going up. And good on the, you know, there's always a silver lining. We are getting more vaccinations done. And last week we did have some people getting their first and second doses. So that's encouraging. But boy, you don't wait until you're in the middle of the viral storm, you know, to take cover in the vaccine, because it's often too late. It's just like with flu season, we always tell people to do it, but we're going to keep vaccinating people and just keep doing that. The kid dose is coming. We hear that there's a fourth dose now for people who are immune compromised. So my guess is that there'll be another one coming behind that, because, you know, the immunity keeps waning with this. So it is just a non-ending slog of COVID. Yep. And, you know, the people that are getting, you've seen, of course, I don't need to tell any of you on here, but the isolation period has been shortened. The quarantine period has been shortened. And while people are less infectious, certainly they still are potentially infectious. So, you know, we just keep reiterating that you have to have the masks on and the distancing and the virtual when you can, and that type of stuff. But the good thing is the vast majority of people that are vaxxed and boosted that are getting this are doing fine. So that's the important thing to remember. At some point, we will be transitioning to not worrying about cases anymore, because it's no longer effective. You know, contact tracing and isolation is a tool for public health to prevent where we're at now. So, but it doesn't do much when when you have this high levels of community transmission. And of course, it's not just here, it is everywhere. So we show more cases, but then again, we test about 10 times more than any place in Illinois. So what we're seeing is what other people aren't seeing, but they cannot hide their hospitalizations and death records. So that's kind of where we are. So it's just, you know, day after day after day after day.
Groundhog Day.
It is Groundhog Day, that is correct. But other than that, there's no specific, correspondence or anything that needs to be addressed. Lot less, we're not really getting a lot, knock wood, of, hateful stuff from the community and everything, so.
I do want to mention, and I know other board members, and I think you as well received, and it's anonymous in the sense that we're not going to use personal information, but there was a concern that was brought to our attention regarding dentistry at public health, and specifically a foster parent's ability to go into a room with their foster child for a procedure, and apparently they weren't allowed.
That has nothing to do with foster parents. That just is in general. There's no room back there for one thing, and there is also the issue with transmission. But we have had this rule for, I can't even tell you how long, years and years and years.
What is the rule exactly? Is it X age to like 0 to, I mean?
No,
how-
it's just that the parents don't go back there with the kids because the kid, for a variety of reasons. We have had all kinds of weird things back there. Parents go back there, they take the kids, other kids back there with them because they don't often just come with the one kid. So then they're back in there with like several kids, and there have actually been accidents by people ramming into the dentist or the hygienist, things like that. And it's a safety issue. Yeah, we've dealt with this for, I can't even tell you how long. But yeah, if it's a small child that they can hold when they go back in there, then that can be allowed. But in general, it's not. And the kids tend to act better as well when there is not somebody back there with them. Same thing with how kids in general act when their parents aren't there hovering over them when they're doing something. So yes, so we know that is not always popular with people, but it's been something we ran a long time ago. We ran it through Fred and everything, and it was it's not something that all places do, but it is done, certainly, and it's done in a lot of places. But so that's why we do it. It's really mostly a safety type of issue. And if you sat in my office, you would know that there are definitely parents that do go back there, and often there's a lot of screaming and stuff going on at the kids if the kids are acting out, and because they're scared. So that just is what it is, but it has absolutely nothing to do with being a foster parent or an
No,
adopted
and
parent.
I only use that just so everybody knew who I was speaking of. Danielle, I'll let you speak. I have a few comments, but Danielle, go ahead.
Is this related to Medicaid payment, or is it just a CUPHD rule?
I don't think it's related to Medicaid payment,
Okay.
to my knowledge. I mean, it had to do with our dentists, and in the past, this has been going on, like I said, for years and years. And it had to do with basically with problems back there. Parents coming back there, bringing other kids in there, they're running around, they're messing with stuff, they're bumping into the dentist or the hygienist when they're in the kid's mouth. I think, Pat, at one point, didn't we have somebody get like stabbed by the drill or something weird?
Yeah.
Yeah.
we did.
So, I mean, it's that's what it is.
So it seems like it makes 100% sense that parents could not bring other children back. The safety concern there makes a lot of sense. That said, years ago when I was, I had eye surgeries when I was 2 and 3 years old. My mother was not allowed to go back with me. The science at the time when perhaps this rule was created is that it's better if the kids, see the doctor, the dentist, and the parent doesn't freak out when they're screaming. But that is not the science at this point. The science around attachment parenting and care for children and decreasing trauma and preventing phobias of dentists is very clear. And that science is that a parent needs to be able to care for their small child and provide support and security when something scary is happening. Unless there's I understand a parent not being in surgery because of concerns about sanitation, but I really don't understand why a parent could not be present to specifically for them to soothe and to support the child if the parent wanted that. And it's of great concern to me that a survey of parents, there's no private paying parents that I could find who actually are not with their children. It is common practice with private, insurance or private pay parents in the private market to be present with their children. It's very common. And actually the only place where it's uncommon is specifically at public health. And so there were multiple, there was kind of a thread on this issue and there were multiple people weighing in. And I really understand where the rule came from because it came at a time when the science around parenting and trauma was really different than it is now. So it's of great concern to me that we would not allow a parent, if they so choose, to go back with a child without any other children looking at a certain age group. Like, it may be that, once the child is 13 or 14, it doesn't make sense. But for younger children, it absolutely can be a source of trauma if their parent is not present during a procedure that they're awake for.
Yeah, well, we can run this again. This came from the dentist and the issues that were being caused in there. So the problem is that we've had is when somebody comes in here and they have other kids with them, they cannot go back in there. There just isn't room, and it's a problem. So and so that's been the rule. So I mean, it may be that if it is, we'll bring it back up with the dentist again and talk to them about it.
Yeah, I would like to, I would entertain I will make a motion that maybe we review this policy. And the dentist can have say in it, but my parents were foster parents for most of my youth, and many of the kids that we had in our house needed that extra support. I mean, foster kids of all kids, not just foster kids, but they're I think uniquely challenged with many traumas too. So I understand everything, and like Danielle noted, it makes sense. I would at least like us to reevaluate the policy that's associated with that. And I perfectly understand not having other kids go back there, but if there is a parent there and a child within the age group that maybe is the most appropriate and we determine, I'd really like to see us change that policy. And if the dentist.
We've also had parents who want to go back there and then leave their kids in the lobby. Also, we cannot have that as well.
I know, and I agree that too. I mean, this is going to have to be common sense, and I think that
it is because it's, but once you,
we'll have a policy. I mean, so I'm making a motion now. I think it's appropriate that we, and I don't know if this would fall under Pat's purview or not, that we evaluate the policy that's associated with kids going back to visit, or kids and
no, we'll just go back to the dentist and discuss it with them and talk about the concerns and and follow up in the next month and figure out a way that it can be clear. And again, we've told parents, I can't tell you how many times they work with parents over the phone about coming in, but still a lot of times other kids come in or
sure.
So it'll just have to be very clear.
Understood.
But what has happened in the past is when somebody then goes in, then the other people freak out, like, why can't we go in? And so
let's address the policy and we'll go from there. Kyle, I know you have your hand up. I'm sorry, I just moved over the screen.
And I don't want to be redundant, other than to say I agree with the sentiments of Andy and Danielle. And I also understand the space issue, particularly with people with multiple kids. A lot of times people who are using public health are on Medicaid and, might be in a situation where they don't have somebody to watch their other kids.
Right.
And I can see how that can definitely be an issue. The point I want to make, I used to work at an elementary school and they had a, very strict policy about not being alone with children. And if you absolutely had to be in that situation, the door had to be open.
No one's alone with the children. There has to be, so in these little small rooms, you already have the dentist and the hygienist in there.
Okay.
And the kid, and then, a parent or, whomever, but so, and you're certainly more than welcome to come over and take a look at, the operatories and everything and how they're set up. But the doors are not closed. This is a very busy clinic back there.
Okay,
But
thanks.
yeah, we will take this up next week with the dentist. Well, as soon as the dentists are both back in.
Thank you, Julie.
Hmm?
Any other correspondence?
Julie, did you want to talk about the PTO cash out?
Yeah, I probably should do that during correspondence, I guess.
Yeah, there's no
We did
other
not
place.
get that on the agenda for this time, but we are looking at really wanting to do that because there are quite a few people, I don't know exactly how many, Pat would know that, but who have accumulated PTO over the last 2 years that will never be able to use it. So we would, and me being one of them actually, but we would like to be able to cash that out rather than lose it or accumulate it forever. So
We discussed this last month, right?
we did, but we didn't put it on the agenda. I don't know how it got, we were having the transition with Josh leaving and everything, and I think it just didn't get put on there, but we
I
wanted to
don't
know.
think, I don't think we can act on it without it being on the agenda. That would be my preference.
All right, so we'll put it on the next one, but we
Yeah.
did talk about it, but we did not put it on the agenda. So if you want to talk about it more, this meeting, we can, or we can just put it on there.
Unless somebody else would like to, I think if we put it on there to act for next meeting, we can have any discussion, and I felt like it was pretty simple from our perspective. Any old business? I don't believe so. New business, approval of payments to Board of Health appointees, just Treasurer Ron Fields in the amount of $474, check request number 3029.
So moved.
Second,
I have a motion and a second. Any discussion? Ron's not with us today, only because Mandy's on vacation, and so there wasn't a report for him, so he requested the day off. May I have a roll call, please?
Andy Cornstrom,
Yes,
Kyle Patterson,
yes.
Danielle Chenoweth.
Yes.
that passes 3-0. Approval of commercial lease agreement between the McKinley Foundation at the University of Illinois and Champaign-Urbana Public Health District in the amount of $2,472 plus additional $400 security deposit for the period of January 1, 2022 to December 31st, 2023.
So moved.
Second,
Any discussion? Roll call?
Andy Cornstrom,
Yes.
Kyle Patterson,
yes.
Danielle Chenoweth.
Yes.
That passes 3-0. Approval of payments to Stocks Office Furniture in the amount of $8,038.46 for CU Public Health / HealthWorks Furniture.
So moved.
Second,
Discussion? Hearing none, roll call?
Andy Cornstrom,
Yes.
Kyle Patterson,
yes.
Danielle Chenoweth.
Yes.
That passes 3-0. Approval of intergovernmental grant agreement between the State of Illinois Department of Public Health and Champaign-Urbana Public Health District in the amount of $199,677.95 for the period of July 1, 2021 through June 30th, 2022.
So moved.
Second,
Discussion? Hearing none, roll call, please.
Andy Cornstrom,
Yes,
Kyle Patterson,
yes.
Danielle Chenoweth.
Yes.
that passes 3-0. Approval of public health marketing and communication specialist job description.
So moved.
Second,
Discussion? Roll call, please.
Andy Cornstrom,
Yes,
Kyle Patterson,
yes.
Danielle Chenoweth.
Yes.
that passes 3-0. Approval of Board of Health appointee, approval of Board of Health 2022 meeting schedule.
So moved.
Second,
Discussion? Roll call?
Andy Cornstrom,
Yes,
Kyle Patterson,
yes.
Danielle Chenoweth.
Yes.
that passes 3-0. Pending grant contracts for the administrator to sign. I don't see any. Doesn't look like we have any. Our next meeting will be a study session if needed, January 26, 2022 at 10:30 in the morning. And a monthly board meeting on February 7th, 2022 at 4:30 PM. There's no
think
other
that-
business? What's that?
I think that February should be the 14th and not the 7th.
Okay. Sounds good. Is that right? That'd be the right day of the week.
The second Monday of the month for the
Okay.
14th.
Yep. Anybody have any other business?
Were we gonna discuss the SB 3015?
I don't know. We were, weren't we?
Yeah, that was the penalty for harassment. against
Yeah. It never made it on the agenda though, did it?
It,
Yeah.
it actually, it's.
It is on there,
Oh, it is? Oh,
number
did I
6.
skip it? My apologies, I did skip it. Well, where is it? Oh, I see it. I'm sorry. Thank you. Going back to number 6, discussion of Senate Bill 3015, a bill to enhance penalty for harassment and threats to public officials. Julie, do you know a lot about it?
No, I mean, I know that it has been a problem. Certainly, it's been a problem in other areas more than here. There have just been all kinds of horror stories coming out of there. I think that the reason why they want me involved in probably testifying on this is not because it has happened here, but because a lot of the other health department administrators simply will not be allowed to go and do it. So, you know, I've been extremely lucky living in this community, and while we've certainly had some problems, nothing like my colleagues have experienced, nothing like that.
And in summary, this bill makes it a class 3 felony, would make it a class 3 felony.
Yeah, and it's more important than just COVID, because in the past where we've had mostly our issues have been related to environmental health staff. Certainly, it's always regulatory staff that have problems. And sometimes, although we haven't had it, but others have had issues with like home visiting teams for various things. We haven't had that issue. We've had some over the years with clients who, and there's a big difference. Like we have had problems with clients in the past that have had, you know, some mental health and substance abuse issues, but that's not really what we're talking about here. We're not talking about established clients, you know, doing this type of stuff. We're talking about people who may not even know we exist, and all of a sudden they're popping out of the woodwork to harass. But it would really mean anyone who is threatening or causing harm to health department staff. No different than you can't do that to most other staff. I don't know how it's going to be different exactly. I wouldn't think you'd be allowed to, you know, punch or something anyone really, but I think, you know, Ruth.
Ruth, is it a felony to threaten somebody who's not a protected class?
Well, they can charge it as misdemeanor battery, misdemeanor assault, or felony. And so I think it's sort of, from what I understand without having looked at it a whole bunch, is that it creates this as a class. And so a class 3 felony, that's a pretty serious offense. And so I think it helps to clarify, this isn't one of those just misdemeanors. Oh, you know, you'll probably get conditional discharge or probation. No, this is serious stuff. And I think it elevates that level to make it clear that society takes this very seriously, and listing it as a felony as opposed to just, you know, a class. The misdemeanors are letters, the felonies are numbers. So a class A, class B, that sort of thing. This is serious. And so you want to think twice about whether you're really going to do this or not.
But of course they won't, which is part of the problem. But I mean, that's what we're talking about. People who are, you know, and we've had people chase environmental health inspectors over the past, like, I don't know what you call it, but like act like they have a gun. I don't know if the gun was ever shown, but that type of stuff, you know. So, and again, there are more horror stories outside of Champaign County, certainly.
I mean, part of it sometimes is the publicity as they do around domestic violence issues and that sort of thing is, you know, and how much the public health district wants to do it or how much the press would pick up on this. on this legislation. And, if this is something you're going to do, then the state's attorney has the tool to be able to make these charges. And if people hear that enough, maybe they'll
Not
decide
do
they're
it.
not going to go along with it.
Yeah,
That's the hope.
and I think that's the point of it really, is to say, look, but like, don't do that. I can't, I don't know how many times it will happen, but certainly I think that it would have helped a lot of my colleagues. It's probably too late for some of them, but it would have really, I think, helped.
I'd like to make a motion that the Champaign-Urbana Public Health District Board sign a letter of support to Senate Bill 3015.
Second that.
Discussion.
Uh,
Danielle?
I saw this on the agenda and I looked up the legislation. And, I am on the fence on this topic. On the one hand, I actually think the benefit of this law is that it would get law enforcement to take seriously these kind of threats, because it's a misdemeanor offense. Oftentimes law enforcement says, I can't really interrupt it. You can ask the person for no trespass, but it's a misdemeanor offense and therefore I can't really take them to jail because of the bail bond reform, all this stuff. I've gone through this personally in our office, so I'm aware of the stories law enforcement says when there's threats. So I think it could be useful in that way because it helps folks take seriously the issue. I am also very aware that as we continue to escalate fines or the severity, especially since there's something already in place around this, that it just feeds a criminal justice system that's really broken. And I generally think that when people are escalated, they don't really think about penalties and consequences in that moment. So I'm not really sure if this is the best approach to addressing the issue, but I really feel for the concerns. I saw them locally. I saw some of the things you had to go through, Julie, and your staff this last year. And yeah, I would like to get people's attention around this issue, and I would like to make it very clear that it's not acceptable. So.
Kyle, do you have anything?
No, I think it's a good idea. I think obviously this is a problem. And as Julie said, we've been fortunate to not have a lot of serious things here, but I mean, I think a benefit of this too is that I don't know if it's been a problem in Illinois, but I know around the country, there's been a pretty large exodus of public health workers, public health administrators. And I think maybe something like this could possibly shore up more people who are, on the fence about leaving the profession. So, I think this is probably a good step.
Yeah, I mean, there's already laws on the books about, punching somebody or things like that, but it still happens, or shooting somebody. But so we know that it's not going to be, anything magical. The way I view it is, and maybe it won't work like this, but more of a deterrent thing to say, look, enough crap, because it's usually environmental health people that get this, when they're in the field, whether they're trying to shut a place down or, something like that. That's where I think the most issues have been. The client issues that we've had have almost always been able to be de-escalated. So that's not really who we're talking about here. We're talking about people threatening to run staff off their property with a gun, or, things like that, or touching them, or, we've had weird things in the past, and there was really nothing that would be done. A lot of times these happen in the county. I know that's surprising, but this would be everywhere. So that would be helpful.
Okay, so the motion is to have the Board of Health sign on in support of Senate Bill 3015. We have a motion and a second. Is there any other discussion? Roll call, please, Amy.
Andy Cornstrom,
Yes.
Kyle Patterson,
Yes.
Danielle Chenoweth.
Present.
All right, that passes with 2 yes and 1 present vote. Does anybody have any other business? Thank you all. Please be healthy. And we are adjourned at 5:01 PM. Have a good night.
All right.
Thanks, Andy. Take care.